It's your boy number 5, coming at you with episode 3 of Diaries of Doctor Number 5. There are certain characters who you come across as a junior doctor who provide you nuggets. And those nuggets are so important to molding the final doctor that you're going to be. And today I'm going to introduce you to one of those people from whom I've taken so much from actually quite a short period of time, and has helped me become the person I am today and the doctor I am today. So I hope you enjoy. So let me set the scene of where we are. In terms of geography, we're going to a small district general hospital in northern Lincolnshire, in a town which is very famous for its fish and chips. And I was a first year junior doctor. In fact, it had been my 5th month in medicine. So I was very, very fresh, very raw, coming out of medical school. And I was working in the general surgery department. Now, general surgery, I didn't ever really understand what it meant, but essentially it's any surgeries which are in this part and include the exit hole as well, okay, as a rough guide. And things like an appendix or a gallbladder operation, they come under that umbrella of general surgeries. In terms of the team, obviously you've got a very large team of, nurses and physios and all these kind of nutritionists, all these kind of people. But in terms of the doctors, you have your boy number 5, who was the first year doctor, so the baby doctor, junior doctor. Then you have an SHO, who's a 2nd year doctor. In this case, this was Dr. Riri, we'll call her, Dr. Rhiannon. After that, you've got the surgical trainee. So this is the person who really is into their surgery, who wants to become a consultant. And for us, that was Mr. Borda. And finally, the big fish himself. Yeah, I remember my first day really well. We had a tiny little doctor's office that's seated around, 6 people comfortably, but we usually had about 12 to 13 people in there at any one time. And I was waiting with my clipboard, just nervous, didn't really know how surgery worked. I'd only been in medicine for 4 months, and it'd been a rough ride. It'd been a real experience and a lot of learning gone along the way. I didn't feel like I was on top or in control of anything. So in came the team, my SHO, my registrar, and then an Indian man with a tidy moustache, focused gaze and a smile on his face. He looked me in the eye and he said, "Good morning, I am Mr. Sasapu. You are my team. Introduce yourselves. Wait. Bota, I know you already. Welcome. What about you?" And I was looking at my SHO, who was like, "Hi, Mr. Sasapu, my name's Dr. Rhiannon, da-da-da-da-da." "Welcome, Rhiannon. And what about you?" My name is Niloy Datta. Hello, sir. Niloy. Welcome. Nervous? No, just my first day, surgery. I just don't really know what to expect. Expect the best. You're on Sasapu's team. Come. So there I was following this man. I didn't have a clue where we were going, but all I knew is this guy has presence. And it's what the kids nowadays call swagger. He had something about him that made me feel like whatever happens, I'm going to be okay. Now, the surgical ward round is an interesting thing because surgeons don't want to be there. That's not their natural habitat, okay? So things happen fast, and you're the junior doctor. You have to make sure that stuff is written down and investigations are requested and things are actually done so that, if something crazy happens or somebody dies, there's some paper trail. Because if it was up to the surgeons, it'd be like, bang, 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 we're going to theatre. And certainly Sasapu's ward rounds were no different. Sasapu was like an assassin. He was efficient. He was calculated. He wasn't going to waste time with time wasters. I remember one patient who had an infection around his bottom. And the question was whether we were going to drain it or not. We were happy to take him into theatre to drain it, but he was reluctant. Sasapu came in. He introduced himself. I am Mr. Sasapu. What can I do for you?
Mr. Sasapu, I don't want to go for. I don't want to have surgery. I've got to move house. I've got to ride my bike. I can't do it if you do surgery on me.
Well, what do you want me to do?
Just send me home, Mr. Sasapu. Send me home.
Very well. Go home. Neloi. Discharge summary. Antibiotics. Home.
Yes, okay, yeah, sir, I can do that. That's fine.
Okay, yeah, I'll do the discharge summary, no problem. Neloi, I know it's your first day, but you're doing very well. Do you have any questions?
Actually, yes, sir, I have a...
I looked at the patient.
Looks like you're on your own, lad.
It's going to be a long 4 months. So I hope you enjoyed that. That was kind of an introduction to the big man himself, the big fish. And, like any good lobster bisque, I've been watching too much MasterChef, there's a certain depth of flavor that I want to create with this character. And I can't do it in one story. So bear with me, and you'll get to see a lot of this person throughout my experiences. I guess in terms of a learning point, Mr. Sasapu taught me about presence. He taught me about demeanor. He taught me about the importance of being calm and reflecting that in everything you do, because the patients feed off of it, and so do all the juniors, everyone around.